Hi, we're MSJC second semester students, and we are doing a YouTube video on amputation. I'm Amanda, and I'm going to be giving the scenario.
I am Arnold, playing the patient.
And I'm Nick, I'll be the post-op nurse.
And I'm Maria, I'll be the discharge planning nurse.
Mr. S was rock climbing by himself when he lost his footing and slipped down the face of the rock. He ended up at the bottom with his leg crushed in between two rocks. Our patient, Mr. S, said that he was there for about an hour until hikers came and rescued him. Mr. S presented to the emergency department with trauma to his left lower leg. Upon assessment, I observed cyanotic tissue from his knee all the way down to his foot. There was no presence of pedal pulses or cap refill. The x-ray came back showing multiple closed fractures. The CT scan also identified bone destruction in both his patellofemoral joint, and also his tibia and fibia. The ultrasound came back showing trauma to the vasculature and indicating no blood flow from the knee down. From the x-rays, the CT, and the ultrasound, and the lab work, the doctor has decided to do an above-the-knee amputation. Our patient, Mr. S, has signed the consent form, and he's ready to be transferred to the OR room.
Come on in.
Hi there, how are you?
Hey, good. How are you doing?
I'm pretty good. My name's RN Gray. I'll be the nurse working with you today. Can I have you state your full name and date of birth?
Sure. It's Mr. S, May 1983.
Okay. And do you have any allergies, Mr. S?
No.
No,
That
no
I know
allergies.
of.
Okay. Are you in any pain right now?
It's minimal right now.
On a
Just
scale
a
from
little.
0 to 10, 0 being no pain, 10 being the worst pain, can you rate it for me?
I would say about 3, 4. Just mostly soreness. So, yeah, I just had this surgery. Yeah, it's a little more just soreness.
Okay. Do you know which hospital you're in?
I believe I'm in community hospital.
Okay. And what year is it?
It is 2014.
Okay. All right. So what I'm going to do, I'm going to go ahead and do a neuro assessment on you,
Okay.
which is going to consist of shining a little light in your eye. You're going to look at the wall behind me, okay?
Okay.
All right. Can I have you smile for me? Can I have you shrug your shoulders as well?
Sure.
Okay. Can I have you grasp my hands? Okay, very good. And you can move all your fingers?
Yes, sir.
Okay. All right, I'm going to go ahead and run my finger down your arms, okay? And you tell me if you can feel that, okay?
Okay. Yes.
Okay?
Yes. 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 Yes.
Okay, can you wiggle all your toes? Okay. All right, Mr. S, your medications that have been ordered for you include your pain medication, which the doctor's ordered morphine. Okay, you need to watch out and let us know if you have any nausea, vomiting. Also let us know if you have any sort of a pain increase. We want to try to keep you for sure under 7. We'd like to keep you around 4 or 5, okay? Before we give you any of the pain meds, we're going to go ahead and give you some anti-nausea medication. The doctor's ordered Zofran, and that's to prevent the pain medication from causing any nausea or vomiting, okay?
That's good.
We also have you on a antibiotic. This is a broad spectrum antibiotic. The doctor's ordered amoxicillin while you're here, okay? And that's going to help with any of the infection, preventing infection in your leg, because you've had the surgery. You still have an open wound here in this wound vac that's draining the fluid from the wound, okay? We also have a blood thinner, Coumadin, that the doctor has ordered, and that's going to help to prevent any clotting of the blood clots from forming, since you've had the surgery here in your leg. And as well, he's also ordered a stool softener, and this will help with the help the stool from getting too hard because of the pain medications that you're on, so that you'll be able to pass stool without straining. Do you have any questions about any of these medications that have been ordered for you? Okay. Okay. Thank you, Mr. S. Mr. S, I'm going to teach you how to redo your bandage here, okay? You're going to start on the outside of the stump and move down diagonally. Figure 2 here, cover the end of the stump, pulling the bandage to add tension and apply pressure. Cross to the other side of the stump, ensuring the bandage is covering the stump right up in the groin, okay? Figure 3 to 5 here. We're going to continue with diagonal turns and covering the remaining stump. Each turn should be several millimeters higher, as you can see here. And then in step 6, we're going to place the next turn up around the waist to secure the bandage. Step 7 here, we're going to finish by fastening the bandage above around the waist with tape, as you can see here. Metal fasteners should not be used due to the risk of scratching the skin. And then lastly here, figure 8, check that there is no loose skin in the groin area and that the bandage has no folds or creases, particularly over the end of the stump. This bandage, this wrapping is called the figure 8.
Hey, I do have a question about the stocking. It looks like some kind of a really tight white stocking.
This is called a TED hose, and it's actually to help with the circulation so that you don't form any blood clots because we've amputated your leg. And we only have it on one leg, obviously, because we've had an amputation on the other leg.
Okay, should it be really tight around my...
It's supposed to be real snug. Okay, Mr. S, another thing I want to go over with you is since you've had your amputation, we're going to need to change your position while you rest here in bed, okay? This will help prevent any contractures. We also want to have you lie on your stomach twice a day, and this will help prevent hip tightening. We'll start exercising this other leg. You're going to have physical therapy up here shortly. When physical therapy gets you up here, they'll show you how to use the crutches and movement and transport from the bed into the wheelchair so they can stand you up on the... Another thing, Mr. S, I want to go over with is the incentive spirometer. This is going to help keep your lungs expanded.
Okay.
You're going to go ahead and you're going to take a deep breath out. You're going to insert this in your mouth.
All right.
And then you're going to inhale. And you want to try to have this second ball here go up to at least right here. Go ahead. And that's going to help prevent any sort of fluid secretion buildup in your lungs, okay?
Okay.
Do you have any questions?
Yeah, how often should I be doing the incentive spirometer?
About 10 times an hour, okay?
10
Sounds
times an
good.
hour. Okay.
Hello,
Hi.
how you doing?
Good.
I'm Maria. I'll go ahead and wash my hands. Yeah. Take a look at your name badge here. Can you verify your name,
Mr. S.
all right, and your date of birth?
May 1983.
All right, good. I'm the discharge planner, and I just wanted to go over a few things with you. I understand PT already showed up,
Yes.
and they went over, taught you the use of the crutches,
Yes.
and you understand that that's going to be your mode of mobilization for the next 3 months until that heals, right?
Yes.
Okay. And I know they went over some range of motion exercises as well that I want to remind you that you need to do those to strengthen your limb and to prevent contractures while you're dealing.
They did.
And the post-op nurse went over bandage changing.
Yes.
Okay. And what kind of bandaging did he teach you?
Method called figure 8.
Okay, good. Any questions with that?
No.
Okay, good. I want to remind you that you need to change that once a day when the sutures are in. Once you get your sutures removed, you need to change the bandages about 3 times a day.
3 times a day.
Okay. While you're changing the bandage, it's important that you inspect the site. You want to check for inflammation, signs of infection, which would be redness, any drainage, pus, and any pain. You want to report to the doctor immediately. Okay. And then also when you are changing the bandage, make sure you don't dangle the limb over the bed. That will increase inflammation. So make sure you're in a seated position just as you are. Okay. Go. Okay. I also included here for your discharge packet, extra bandages, tape, and sponges, so you can provide your own bandaging. We also arranged for you to have a home health nurse. Do you know what that is?
Yes.
Okay, so a home health nurse is gonna come to your home, show you how to rebandage it, and just assess your site. Okay. Also, I included a discharge packet, and it's just the instructions on how to change the bandage, just to refresh your memory, and also the medications that you're on, which I will go over the medications. This is yours. We're gonna put you on Lovenox. Yes, it's a clot prevention, and you're gonna have to take this in the AM, preferably about 9 a.m. or so when you wake up, and it's gonna be an injection. So we're gonna teach you how to inject yourself with the Lovenox. Okay. You're gonna hold the syringe,
Okay.
and with this hand you're gonna pinch the skin.
Okay.
Yeah, pinch the skin, and then you're gonna utilize this syringe as dart-like method. There you go,
Okay.
and then with the top finger, you're
Yes.
going to
Inject myself.
push down on the plunger, okay? And then you're gonna dispose of the needle, the syringe, in a coffee can. Say that coffee can, and then you can bring it, dispose. Also, I want to talk to you about one more important thing, is that we have a support group here at the community hospital, and it's called the Amputee Coalition. Is that something you would be interested in? Sure. Okay. Good. I already spoke with the coordinator ahead of time, the coordinator of the support group, and they would be willing to provide you transport to and from the support services. And he will be calling you tomorrow morning while you're at home.
Sounds good.
All right. And any other questions?
Thank you so much.
Okay, you're welcome.
I was wondering, what kind of food can I eat to speed up the healing?
Typically, you want to eat proteins such as chicken, fish, and you want to also have some carbs, good carbs. Stay away from your starches.
Okay.
Also, dairy products.
Oh, yes,
You
yes.
can have some dairy. That will aid in your healing.
Okay. I like to take vitamins at home. Are there any type of vitamins or supplements I could take also?
Yeah, for healing, you can take vitamin C and vitamin zinc. Also, vitamin A will aid in the healing process as well and prevent infection.